With Evan Brand. We're going to be going into reducing inflammation in the joints and how to improve joint mobility. And we're going to be talking about it more from a biochemical kind of metabolic inflammation standpoint. So excited to dive in on that topic. Evan, how are we doing today, man? What's cooking?
I'm doing pretty good. I was telling you about my shoulder. I was lifting some heavy things over the weekend, and my shoulder got a little tight on me. I thought, uh-oh. So that spurred the idea of this conversation, and I hit some arnica homeopathic 30C, which worked very well. It's not necessarily root cause, but it has been helpful. And I wasn't trained on homeopathy, so this is something that you and I have kind of dove into in our personal lives with our kids and such, and it's been a game changer. So, I mean, out of the gate, I think that's something to have on hand. Even if you don't know biochemically or root cause what's going on, at least you could remedy your situation, feel a little bit better and buy you some time while you're investigating.
100%. And so when I look at joint issues, right, you have physical inflammation that's being caused by physical things, right? The most common things are going to be either over exercising too much, probably less common on that. And the other one is just very poor posture, right? So, like, the easiest thing out of the gates is you're either sitting in a really poor chair that has poor lumbar support, right? Lower back curve support or cervical curve support. So, the easiest thing is just get a really good, high quality rated ergonomic chair, especially if you're sitting a lot, right? That has cervical support and lumbar support. That's super helpful. That way, that part of the spine is supported. Ideally, be able to stand portion of your day. I mean, right now I'm standing. I don't think you are. So I stand at least half my day. I have a treadmill that I'll slide it under there. I have a QB stepper. So I'm always trying to keep some movement in there. I get about 15,000 steps a day. So it's very helpful to be able to move, get some steps. That's helpful for the joint. The disc in the joint get hydration through imbibition. So the joint has to pump and move to get hydration into the joint. So movement through the joint is super helpful. So being able to stand for a portion of the day, sit a little bit with good support, getting some movement, super helpful. And then depending on kind of where you're at, if you have inflammation, if you have pain, I mean, you can do simple core kind of postural functional movements to strengthen that area. I mean, one of the things I like are there's a book by Eric Goodman called Foundation Training, where he just does some simple posterior chain work, like a standing prone cobra with the chin pull back, right? That activates the deep cervical flexors here. And then you can bend down to a 45-degree angle like this.
I love
Hold
Goodman
that
training.
position for 30 seconds. You can also bring it up like this and get the whole posterior chain activated. And then you can also reach down and then create traction with the spine. So go look at Eric Goodman's work. He is just at these 3 or 4 movements called the Founder. Those are really good movements to get the posterior chain working like this, simple stuff out of the gates. And so I like that to get the posterior chain, good stability with your chair, invest in good money on your desk chair, get some ability like a stand desk to be able to stand up throughout the day, even if you're just kind of moving, going back and forth. These are super easy ways to kind of get simple movement through your spine during the day so you're not sitting all day. And if you are sitting all day, at least invest in a really good chair and try to get some kind of a stand desk where you can go up and down.
I do this little bar stool too, and that way I could just lean my butt on it.
Yep.
So I'll just put my butt on that, but I'm still standing. I'm just kind of leaning back on it. I know there was some really expensive thing. I can't remember the name of it a few years ago. I think Mark Sisson was promoting it, but it had like rocks. It was like this thing that he leaned. It was almost like a pogo stick with a seat. And so it was like this imbalanced chair. So you're sitting, but you're standing, but there's like rocks on the floor. And so he'd put his bare foot on the rocks. I don't remember what it was, but this kind of my homemade version of it, this little bar stool that I'll just kind of leave off kilter. That way my butt's just taking a little bit of load off. Because if I just try to stand all day, my back hurts. So standing all day just doesn't work for me. But with a little bit of lean, it helps.
Yeah, they have these little, they're called like wobble board chairs.
Yes.
There's one called the Luna standing desk tool. It's kind of like that. It kind of has like it looks like a pogo stick, right? But it's got a flat surface. It's kind of oblong. So then you're kind of sitting on that. You kind of have to balance. So then it activates
Yeah.
the core. But then you can kind of move around and kind of get some movement in your hips, which is good for your spine. You can also just get like a Swiss ball, right? And just sit on one of those. And that way you're getting some movement and you won't have as much support in the back. So you really have to activate your core, activate your back. So you can sit up there straight. That's good. Nothing wrong with that. And so that's helpful. You probably wouldn't want to do it all day because you'd be really keeping these muscles active all day. But it's nice if you're at a desk, you can at least bring that in, bring the wobble board stool type of chair in there. These are a couple options, minimal cost to bring in some good core activation. And when I say core is everything. It's like the whole thing. Core is your back, it's your multifidus, it's your iliocostalis muscles, right? It's your longissimus muscles. It's obviously like your TVA, it's your rectus abdominis, it's your oblique, transverse, external, internal oblique, right? It's everything around your back and front abdominal area.
And people may be listening and go, God, why does that have to be so complex? I got to get this fancy chair, or this or that. Well, because we didn't really evolve to be sitting like this all day staring at a screen. I mean, we're just not really built for this. So it's no surprise that we see so many people with mobility problems. I mean, I've been to several different physical therapy people over the years just for random injuries and aches and pains. And they all tell me that in their careers, these are people that have worked 20, 30, 40 years. They've seen just the rise of younger and younger people having worse mobility because they're just sitting at a desk all day, and how it's shortening the muscles. I think it's the hamstrings, right? It's shortening the hamstrings when you sit all day.
Well, I would say it's probably shortening the hip flexor muscles, right? Because the hip flexors, right? When you flex the hip, you're shortening that muscle. So you're creating that muscle shortens, and that muscle is insertion is on the lesser trochanter in the hip flexor in the femur muscle, in the femur bone. So the lesser greater trochanter muscle, the top part of the femur. But then it inserts. No, that's where it inserts. The origin is, I think, from L1 to L5 on the spine. And so when you have tighter hip flexors, it pulls super tight on the origin, which is going to be L1 through L5, I think, transverse process. So, and even the ribs. So it'll pull really hard on that back. And so a lot of times your chronic lower back pain isn't going to be from the shearing force from really tight hip flexors. That's part of how lower cross syndrome happens, right? Lower cross syndrome is nothing more than super tight hip flexors on one side, and on the other side, weaker glutes and weaker lower abdominal muscles. So weaker lower abdominal muscles, weaker glutes, because you're not using glutes to step up or squat or lunge. And then you're getting these shorter, tighter hip flexor muscles. And that's the lower cross syndrome, right? One cross is weak and loose, or weak and tight. That's your hip flexors. The other one is weaker, and that's the glutes, and that is the lower abdominals. And so this is common. And so people talk about investing a lot of money in beds, right? Like, I have a nice Tempur-Pedic bed that's pretty expensive. I know you have a nice bed as well, but we spend just as much time in bed as we do sitting in our chairs all day. So I think people should have, enough money invested in a really good chair that has good postural support. You can go to like different ergonomic stores. There's one in Austin called Human Solution on Anderson Lane. They have a lot of great options. I got my stand desk from them. They have some really good ergonomically certified chairs that are excellent, that have the cervical support as well as the lumbar support. These are really good options to kind of start out of the gate. So kind of my thing is start with like, the easiest buy-in, right? The easiest buy-in out of the gate is just upgrade your chair, maybe get a Swiss ball that you can sit on, maybe get your desk, get a stand desk so you can go up and down throughout the day. These are just simple, easy investments. And then if you already have these things and you want to get more kind of biohackerish, like we are, I have a QB, little pedals here so I can pedal. I have my little, I actually got a new treadmill desk, a new treadmill that's under my desk. That's lighter and it goes to 4.5 miles per hour. And I have a remote so I can just hit it. CUBBY. And then my other treadmill, hold on, let me go look at it real fast. And my new treadmill desk is Rhythm Fun. I'll put the links down for Amazon below. Take a peek at it. But the cool thing is the remote, because you can just kill it, turn it off, turn it on without having to go touch it.
Now, if you don't sit at a desk all day, congratulations. Hopefully you're out working in the field or something like that. Years ago, I was working in the woods and building hiking trails and restoring different natural areas, nature parks and stuff. But man, it killed my back. I mean, it was a lot of work, a lot of labor, and not much pay at all. Couldn't raise a family on that wage. So if you are out and you're physical, great, that's awesome. Or if maybe you're just doing that in your free time, maybe that's counteracting your desk work. I mean, that's what I try to do, is even in the middle of the day for lunch, I'll just try to go out and walk around, even if it's just like hiking up and down my driveway, just something simple, just to break it up. And I forgot what her name was. It was Joan Vernikos. I had her on my podcast probably almost like 10 years ago. And I think she worked with NASA or for NASA. But anyway, she talked about the importance of just standing up and sitting down, and just the change in posture was more important than anything. She
Huge.
said it wasn't necessarily the actual exercise, it was just breaking up your sitting. So if you're sitting for 20 minutes and then you can stand for 10 seconds, that was enough, she said, to, positively impact your mobility.
Yeah, I mean, I'm adding another 90 degrees of extension onto my hip flexors, right? If your hip flexors, right, at your leg to your hip, you're at 90 if you're sitting. Well, if you're standing, you go to about 180, 160 to 180, right? So I create more length in my hip flexor, which means it's less likely to get tighter and shorter and create lower back pain. And so that's
Okay.
the easiest thing. So there's a lot of different buy-ins, right? So like we're not trying to give a one size fits all. We're trying to say, okay, if you already have a good desk or already have a really good ergonomically supported chair, maybe upgrade into a stand desk or just get a simple physio ball. Ideally, going from sitting to standing is ideal. So I would say good chair, then go to a good desk. And then if you want to add a physio ball or a wobble chair, that's great. And then if you want to go to the next level and get a treadmill that slides underneath. I think mine was $500, which is great though. My other one was a Rebel Desk treadmill that I used for 5 years. I just got rid of it because of the belt just like almost wore through. And I'm like doing the math. I'm like, all right, it's about the same cost to repair it as to get a brand new one. So I'm like, I'll get a new one that goes a little bit faster and I get the remote. So that's kind of where I'm at. So there's a lot of different buy-ins. Now that's kind of like the lifestyle, exercise, movement standpoint. And remember, I'm not saying crazy exercise. I think the more you can get movement throughout the day that's non-structured is better. Meaning if you can get 10, 15,000 steps throughout the day, where it's non-structured throughout a 10-hour, 12-hour day, that's good. Because if you just exercise for 30 minutes and you sit on your butt for 10 hours, is that really that good? You're still sitting down, not moving for 10 hours. That's still not great. So if you can get a little bit of movement in and you can also have a lot of unstructured movement, that's even better, I think, overall.
I would say so. I mean, I certainly can tell you the days that I exercise and then sit for too long, I'm just as stiff as if I did an exercise compared to times where I'm moving around throughout the day. So yeah, I think throughout the day is better. Let's get into some of the chemical stuff too, some of the infection stuff. I mean, I'll tell you personally with some of the stuff I've had from tick bites, whether it's Lyme, Bartonella, Babesia, different things that create inflammation and affect blood flow. I will tell you that there are some waxing and waning periods, like where hands, feet, knees, hips, that kind of thing can get tight. And so I think ultimately you got to test, not guess. So you and I've talked about this before. Not all testing is 100% accurate, but we do feel that the DNA connections report does give us a pretty good read for different types of Borrelia that we can look into Lyme, and then some of the co-infections, which the name co-infection kind of sounds like it always comes with Lyme. I do believe some people just have Bartonella or Babesia, and those things can really affect people in terms of mobility. So for me, things like Japanese knotweed are very helpful, and I take a tincture of Japanese knotweed. And of course, we'll mix that into some of the other stuff we're going to dive into. But you have to investigate this. So if you've got mobility stuff, or if you sit for a while and you get stiff, or if you're having issues just making a full fist, you can't fully get those fingers in, make a full fist, there's probably something there infection wise.
Well, anytime you create chemical, so I kind of look at like, all right, we have structural inflammation, and we kind of just talked about postural things, like things that you're going to be doing sitting, standing, kind of lifestyle habits. So not like going to the gym, right? That's kind of like our physical, but more lifestyle. Now we have our chemical, and the more inflammation we put in our body, the more it decreases blood flow to tissues, the more it exacerbates prostaglandin 2 and arachidonic acid, which are more pro-inflammatory. It's going to decrease inflammation, decrease blood flow, and then when we increase inflammation and decrease blood flow, decrease oxygen. So when we do that, the tissue starts to become less pliable, right? So think of like beef jerky, very like not pliable, like you have to rip and tear it. The more inflamed you become, the lack of blood flow that you have, right? The lack of nutrition to the muscle, the more your muscle becomes less pliable, less like a nice raw beef tenderloin and more like beef jerky. And that's not good. So when you do movements, you're more likely to tear and injure tissue. And obviously, if you tear muscle, that's more vascular tissue that has good blood flow, so it can heal better. But as soon as you start affecting cartilage and tendons and ligaments, that tissue is very avascular, very poor blood flow. So it's going to be very difficult for that to heal. So big things that we can do is, more vegetables, less fruit and carbs. So keep your carbs in check. Again, if you're more active, you can do more carbs. Be very careful of your omega-6 vegetable oils. Ideally, 2 to 1 on your high quality saturated fats. really important. And then you can do on the vegetable side, you're better off doing your monos, right? Avocado, olive oil. Be very careful of your nut and seed based oil and your omega 6s like safflower, corn, soy, canola. Very inflammatory. And of course, things like gluten, processed dairy, processed grains, sugar. These things are going to drive more inflammation. They're going to decrease blood flow, and just when the more inflamed you are, it can create a lot of inflammatory molecules going through the body, and they just make your body more stiff, more inflamed. The more stiff you are, you can't get full range of motion. Your tissues start becoming less pliable and easy to tear and injure, and you feel just more stiff throughout your movements.
Yeah, well said. And then on the conversation of Lyme, for example, I mean, we know that Borrelia in general likes to eat up your collagen. I mean, it'll really try to hide out in joints and such. So I think collagen supplementation may be helpful too, just trying to replenish some of what's eating up. But then you got to just clear some of the infections. I mean, I'll tell you, if I'm doing some of the anti-borrelial formulations, whether personally or clinically, people can move better. So if you've had tick bites, if you grew up anywhere, almost anywhere in the US except for maybe Nevada or New Mexico, supposedly there's not many ticks there. But beyond that, if you've had tick bites from childhood, I mean, that could be a factor to look into. This could be a dormant infection that's left you alone for 30 years. And then all of a sudden you got exposed to mold, or you had a death or a divorce or a move or a major job stress, or even just the pandemic that's been going on. And some of that stressed people out. And all of a sudden, boom, they have these major joint problems. So who knows? There could be a trigger. But like you said, it could just be over time, lack of blood flow, inflammation together. So what about like
Yeah, all these
enzymes?
things modulate the immune system, right? And so, like, what you're going to see is you're going to see an increase in arachidonic acid, which a lot of these things are come from meat. So it's not bad to have too much arachidonic acid, but if we increase prostaglandin 2 or your eicosanoid 2, that's a more pro-inflammatory pathway. So vegetable seed oils, omega 6, too much arachidonic acid. But if you balance it with omega 3s, high quality grass fed meat, which is very high in GLA, it's not necessarily the fact that you're getting it, it's more of the ratio of where you're at with the others. And so that's fine. Really, what's going to tip you over is the processed sugar, the hydrogenated oils, the trans fats, the soy, the canola, the safflower, too much nuts, too much seeds. That's going to tip you over and put you into a more inflammatory state. And then the more sugar you eat and the more grains you eat, the more your tissue just starts to become less pliable. Now, I have a history like doing applied kinesiology work and using percussion work and chiropractic work. I remember working on a patient, and their tissues literally felt like a bag of cement. And this person like couldn't like, so we would use a percussor, we do some soft tissue, but I noticed that when we got gluten out of that person's diet and grains out of that person's diet and sugar out, the tissue quality totally changed. And it's like if you're inflamed and you have such poor movement, you're not going to want to move. But then if you don't move, the tissue gets tighter. And if it gets tighter, then now you restrict your range of motion, and it's a vicious cycle, right? So you kind of have to get some movement in there. You have to loosen up the tissue. You have to make the diet changes so you get better blood flow, but you got to work into it. Because if someone's coming in really inflamed and they go too over the top, they may create so much inflammation that they have a paradoxical reaction and feel worse. So you really want to ease into it. And so if you're not used to walking, just walk a little bit. Try to exercise just enough where you can repeat it. That next day, you may feel a little bit sore, but you can still function. You can still do all the things you need to do. If you feel too sore the next day where you can't do what you have to do, you probably did too much. So just enough to feel it and know you did something, but not enough where it affects you being able to function.
Yeah, I've got a few physical therapists as clients, and they tell me straight up that they know they're never fully going to get their patients better because of their diets. And these
Yeah,
people are
it's
coming
sad.
in, they're eating like a Subway sandwich as they walk into the physical therapy office. So the physical therapist is doing the best they can, but they know just listening to us that they're never fully going to get them better without the diet changes. And then they're like, well, that's out of my scope of practice. I can't, educate them much on diet. So I'll try to hint at it. But yeah, it's sad because you see billions and billions of dollars being spent per year on physical therapy, occupational therapy, physical rehab, that kind of stuff. People that maybe had car injuries, for example, where there was a traumatic event that led to this mobility problem, but then they never fully recover because they go right back to eating the Arby's sandwich, the roast beef and the bread and the ketchup, and they never fully get better. So I think there's a place, hopefully people pick up on this. You pass this information on to maybe a physical therapist. Get people off of grains, get people off of dairy, at least temporarily off dairy. I think butter, there's maybe a place for that in most people's diets. But I will tell you personally, I've seen the changes in my own family members. If we can get them off gluten or off grains, even for a month, we see improvement. So
Yeah.
it's just, this doesn't sell, this doesn't make money for people. I mean, there's so many pharmaceuticals that people are taking instead, right? What's the conventional approach for these issues? Like aspirin, Tylenol, maybe Aleve, and maybe some anti-inflammatory steroid drugs, right? I would say in severe
Yeah,
cases, those are being
I
used.
mean, you have your like your NSAIDs, which are going to be like your ibuprofen, right? Your Advil, your Aleve, right? I think your Aleve's kind of your time released ibuprofen, right? These are going to help with the prostaglandin too. And again, acutely, for a couple of days, if something happened, that may not be a bad idea. It's the problem is if you're chronically needing these medications, that's a problem. Then you have your acetylsalicylic acid, that's aspirin. And then you have your acetaminophen, which is Tylenol. Again, Tylenol blocks the pain receptors, so it's not an anti-inflammatory. Aspirin is a mild anti-inflammatory. Ibuprofen is an anti-inflammatory. And then you keep on going up into the steroids where you actually get an injection. The problem with that is after 1 or 2 injections, your anesthesiologist or your pain doctor will tell you, yeah, we're going to start to break down tissues and cartilage and tendons. So that's not good either. And so I tell patients, one, you don't want to jump on injections right away because you want there to be some pain signal to tell you you're doing too much when you're rehabbing. So it's good to have some pain signal to tell you, hey, I'm doing too much. Because the problem with these medications is it covers up the pain. And then you may be doing things in your life movement wise that's actually creating more pain, but you can't feel it. Right. So then, of course, you go up the ladder and you'll eventually be on opiates. And that's a problem. And that opiates are very addicting. It's just basically it's blocking the brain's ability to perceive pain. And then essentially the longer you're on an opiate, then, Suboxone, of course, you have you have morphine post-surgery, you have fentanyl, which is like the incredibly higher version above your OxyContin, which is like time-release opiate. It rewires the brain and you start to need more of it to then block that pain signal. And then that creates more addiction, right? So you really want to not be on these pain medications. Now, my problem with physical therapy and chiropractors is a lot of times they can apply therapy that does not fix the underlying issue. So chiropractors are very notorious for just, adjusting a segment of the spine, creating some movement in that spine and calling it a day, right? But if the person's inflamed from their diet and lifestyle, that's not helping it. And also the soft tissue component should be addressed. So when I was a chiropractor doing this kind of work, we would do like percussion. I'd have a percussion instrument, just a couple of minutes to get the tissue warmed up. And that way, when I would adjust, I wasn't having to adjust through all this soft tissue that was so hard. The soft tissue was more loose and I could move that segment. And I'd always talk about how we can get some better movement in the spine with exercise too. Because you don't want the only movement in that spine to be through an adjustment, right? And so getting the soft tissue under control, using some active release techniques to help lengthen the muscle, help break up fascial adhesions, super, super helpful. And so physical therapy, they're notorious. Oh, I have knee pain. Let's just focus on that knee. Maybe they do like an anti-inflammatory, Russian stim or microcurrent or ultrasound. That's good from an anti-inflammatory standpoint, but physical therapy is common. We just only exercise that joint. We only stretch that joint. That's it. They don't look at the instability above and below the joints. Joints very rarely just become unstable at that joint, unless it's an acute injury, right? Someone took out your knee. It's usually there's instability either above and below. So a good chiropractor or PT person will make sure the joint above and below is doing well. So if I see knee issues, I'm going to make sure there's good glute activation. I'm going to make sure the hip flexors are facilitated. They're not overly tight. I'm going to make sure glute med, glute max, all the adductor muscles in the middle are doing good. I'm going to make sure the tib fib joint at the ankle has good stability. I'm going to look at everything above because if there's instability above and below, that knee can compensate and have to work harder. So I'm going to make sure all the muscles around the knee, the glutes that stabilize the hips, the hamstrings that go to the glute that go up to the hips and also help stabilize the knee, the sartorius, the gracilis, semitendinosus, semimembranosus, to make sure everything is stable.
Yeah, and you and I have coached many different practitioners, a lot of them chiropractors, and so many of them tell me, look, I'm just straight up sick of cracking backs for a living because they know that they're going to have to come back every week. They're going to crack the back again, and then they're going to send the patient on their way, and they're never going to get better. And when I was working out of that brick and mortar practice and I started doing functional medicine consults, doing lab testing, getting all of the existing patients in the clinic simply to make diet changes, it was funny, but I guess not so funny for his bottom line, the chiropractor I was working for, because now instead of Betty needing to come in every week, she's like, no, I'm fine, doctor. I'm going to come in 2 weeks or 3 weeks or 4 weeks. And it's because the underlying inflammation was improving based on me fixing the gut, getting the diet improved. So it's kind of funny because
Yeah.
people got in this routine of like, I'll see you next Friday. It's like, she shouldn't need to be cracked again next Friday. You're cracking her today. Like, what the heck?
Yeah, it just depends how acute. If it's an acute episode, you're going to need to do it more frequently the first couple of weeks. But if it's more of a chronic thing, yeah, you got to get the soft tissue under control. You got to get the systemic inflammation in the body through the diet under control. And if you're a chiro, you definitely want to look at upper cervical, right? C1, C2 malalignments can create a lot of problems. So that you definitely want to make sure that's kind of crossed off your list because that can really cause a lot of issues. And that could be a root cause as well. But most people, it's like poor posture, poor sitting, not enough movement, crappy diet, lots of inflammation. And then, of course, muscles can also pull joints out of alignment too and cause them to feel sticky too. So, like, I find the best chiropractors are like the applied kinesiology chiropractors because they would like use a percussion instrument, even just for a minute or two is huge. Or they would do like origin insertion work. They would do like SOT technique, which uses blocks to get the hip alignment better. I found those techniques were really helpful for chronic back issues. And then when you have disc issues too, like you need to pump that back. So whether it's a flexion distraction technique to help open up that disc, whether it's an inversion table or whether it's an inversion table or an inversion device for the neck that goes over the door or a cuff to kind of create that negative pressure to pull that disc in off the nerve roots can be super helpful. But then you got to get the muscles trained down the road. So a good PT or a good postural, program. Like you can start with Eric Goodman's foundation training. There are a couple of really good PTs online that are excellent. Bob and Brad, they do a lot of nice, postural videos at home stuff that are very helpful. People that are in pain. So those are good guys. I'll give them a hat tip. Anything else you want to highlight on the structural stuff? We can go talk about the supplements next. I think that's a good kind of ending point. Anything else, Evan?
Now let's move into supplements. I had already mentioned like some of the enzymes. So I mean, we'll use some of those, and we often use these in combination. I mean, sometimes people are taking serapeptidase, or I'm even personally doing lumbrokinase. I do a lot of
Yep.
lumbrokinase too because that's like way more potent than serapeptidase, and so we use that for blood flow problems with some sort of
Yep.
a coagulation issue. So whether it is infection or mold toxin, lumbrokinase, it's a game changer. But
I
we
want to
also
hit that
use,
one. I want to just hammer that one spot for 1 sec. If we
yeah.
have poor blood flow, which diet and infections can drive poor blood flow, if we can't get the blood flow improved, we're not going to be able to get the inflammation out and nutrition and oxygen in. So, ginger, the enzymes, getting your diet under control. One of the biggest things that helps is coagulation. If we decrease coagulation, we improve blood flow, we improve oxygen, we improve nutrition, we work on pulling inflammation out. That's like a foundational mechanism to getting pain under control.
Yeah, well said. And there's a lot of issues we're seeing with post-viral coagulation issues or even
Yep.
acute coagulation. So make sure if you got some viral stuff going on, you've got to be knocking some of that out too. And we've seen people that are having clotting issues months and months later. So to be honest, in the time that we're under, I am personally staying on and recommending a lot of clients stay on some sort of enzyme just as an ongoing coagulation support. I think it's a very, very smart insurance policy.
Correct. And when we talk about these enzymes, just people that are listening at home, these aren't enzymes you take with food. We're talking about enzymes we take about an hour away from food on an empty stomach. Some of the best ones are going to be the lumbrokinase, the nattokinase, the serpeptidase. Some are really good taking them enterically coated. So they break down in the small intestine away from food so they get into the bloodstream. These enzymes can, one, break up scar tissue, they improve blood flow, and they also can decrease a lot of interleukins and cytokines that are flowing in the bloodstream. So if you're chronically inflamed and you have a lot of these cytokines and interleukins in the bloodstream, these chemical messengers from inflammation, it can actually start to break them down a little bit, which is
Yeah.
good. So that starts to relieve pain. Now, if you get to the root cause where you're getting some movement, you're working on your posture, you're working on sleep and diet, this is powerful because now that starts to accelerate healing even better, faster.
Yeah. And these are proteolytic. So when you're like researching, these are proteolytic enzymes as opposed to, like you said, the ones you're taking with food. Those are digestive. So they're still called
Two
enzymes, but
different things.
yeah, totally
And they'll
different. But
cost a lot more too than digestive enzymes. They're not the same price.
right, right. Yeah, like lumbrokinase. I mean, a bottle of it retail on the one we use, which is the Beloki from Canada RNA. It's like the best one out as far as I know right now. It's like 98 bucks a bottle retail. So it is pricey, but man, it's incredible stuff. I mean, in terms of hands and feet, my blood flow is incredible. That plus beet powder, which is maybe another thing I'll go ahead and mention now,
Yeah.
increasing blood flow. I do like beet powder and I will use some of that supplementally along
L-arginine
with
too.
yeah, arginine, citrulline. I'll take some of those in liquid form and I'll mix those together and drink it all down. Those can be very, very helpful. You mentioned ginger too. Let's talk about ginger because you've talked a lot about ginger for like nausea and digestive benefits, but you and I were looking at some of the papers on it, and it does have a lot of really anti inflammatory benefits too. So that's kind of cool. We're saying that it's a digestive aid, but also a systemic inflammatory aid, correct?
Yeah, I try to add things into protocols that just have a wide net. So I love ginger because one, it's a natural bitter, so it will stimulate digestive juices. Two, it's an anti-inflammatory, so it's very calming. Three, it's a prokinetic, so it helps the digestive tract empty. Because if you have like some kind of chronic inflammation or gastroparesis, food and acids can sit in there too long and create burning. Four, it helps with coagulability, so it helps with coagulation, so it decreases it, so there's less clotting, so you improve blood flow. It also helps with blood pressure as well. So a lot of, and then also it's an antibiofilm. So if we're using ginger to help with like, killing, it can actually help strip the biofilm, which are the protective shields that bacteria use to prevent themselves from being killed. So it helps with the biofilms, which allows the herbs we use to be even better. And again, the enzymes we use also help with biofilms too.
Yeah, a cool study here was just saying that in rat models of liver cancer, ginger extract counteracted oxidative stress and inflammatory damage, and it restored levels of superoxide dismutase, catalase, glutathione, and prevented an increase in COX-2, COX-2, which is one of those pathways you and I were talking about that like some of the natural NSAIDs work on. Ginger is basically a natural COX inhibitor.
Yeah, it modulates, right? The problem with a lot of the COX inhibitor drugs of the early 2000s, like Vioxx, COX is called cyclooxygenase enzyme 2. That enzyme is also very important for repairing the gut lining and repairing the heart. So if you block it out altogether, like Vioxx did, you can destroy the heart and the gut lining. So with herbs, it tends to more modulate, not overdo it, but bring it down in a modulatory kind of gentle way, kind of like an adaptogen works for adrenals and cortisol and stress. Doesn't
Nice.
shut it down, but it just pushes it in the right direction.
That's an awesome way to think about it. So ginger is an anti-inflammatory adaptogen.
Yeah.
It's
Yep.
pretty cool. Okay, let's hit the others too, because there's others we use in blends. How about some of the polyphenols, like the quercetin, the rutin, the resveratrol, the rosemary?
Very
So
helpful.
I talked about Japanese knotweed earlier. The main benefit of the knotweed is because of the resveratrol in it. So
Yep. Japanese knotweed. Yep. That's very helpful.
it's amazing for like rheumatoid arthritis, like I said, Lyme type arthritis, which a
Hmm.
lot of RA probably is Lyme, but it's been not properly diagnosed. So I love those. I mean, I personally take some sort of that all the time. And, quercetin I love too. It's in the vitamin C family. I love it because it's a great mast cell stabilizer. So if you are dealing with mast cell activation, in the case of mold toxin or Lyme or Bartonella, Babesia, Auriclia, Mycoplasma, any of these things, even viruses that are triggering mast cell problems, and you have all this histamine out in your system, the quercetin is really going to calm that down. So that's why I love it. And you can do too much of a good thing, but in general, something like 250 to 500 milligrams 3 times a day of quercetin for me is a game changer.
100%. I would say next we could do curcumin. Much better off to take it liposomally. That's very important. So liposomal curcumin. Also, make sure you cut out nightshades. Nightshades and of course grains and refined sugar can create joint issues. So you'd be surprised how many people that have chronic issues just making those changes help. So liposomal curcumin for better absorption.
Why the
I know you
nightshades? Will you riff on that for a minute? Because
The
nightshades are
solanines,
something.
the alpha solanines, they're compounds, they're anti-nutrients in the nightshade family, tomatoes, potatoes, eggplants, peppers. These alpha solanines can get into the joints and they can kind of create a lot of inflammation. Similarly, with people that have oxalate problems, oxalates can get into the joints, these oxalate crystals, and create a lot of pain issues in the joint tissues, in the muscle belly too. Now, again, I don't go into oxalate restriction out of the gate because there's a lot of healthy foods that have oxalates in them, spinach and green vegetables. So if someone's coming off of a processed food diet, the last thing I want them to do is now be worried about oxalates because that restricts a lot of vegetables. So I don't worry about oxalates out of the gate if someone's diet's crappy. So
Well, and
I would work on getting their diet really clean, and then potentially in some organic acid tests that we do, we could see if oxalates are really high. If do they have a history of kidney stone problems? Those kind of things are helpful.
well, yeah, and don't forget to mention too, candida. I mean, we'll see oxalates driven
Candida,
up tons
bingo,
from a
fungus
yeast
issues.
problem.
Yep,
So I've seen people on like a low oxalate diet for years. They still show up off the charts and they're having these joint pain
yep,
issues. We simply just fix the yeast overgrowth or the fungal problems, and then the oxalate markers go down and their joints are better. So make sure that when you're doing a workup on these type of issues, whether it's mobility or pain or otherwise, make sure you're looking for these fungal colonization markers. You're looking at candida, you're looking at some of the bacterial overgrowth, because all
yep.
these things are going to act as, we'll just say, a toxin in the bucket. And if you get this infection plus that infection plus yeast, then you really have a much, much higher chance of having these problems. And you go take the ibuprofen, you're not knocking any of that stuff out. The yeast is still there.
110%. So the oxalates may be more of a yeast issue, not necessarily an oxalate problem. So something we add to our list. We can also use things like boswellia or frankincense. Very, very helpful. Very good. Again, these things, how they're working is they're primarily modulating interleukins. They're primarily working on cytokines, reducing some of these inflammatory compounds. They may be working on the COX enzyme, COX2. They may be working on nuclear factor kappa beta, right? These are different inflammatory signals or chemical messengers. Maybe working on prostaglandin E2. So they may be helping a lot of these things. So we have to make sure if we use supplements, though, we're not just covering it up like a Band-Aid. We're actually trying to get to the root cause. So again, herbs tend to be better than like an ibuprofen long-term because these things kill tens of thousands of people a year taken the right way, right? Go look at Wolf et al., 1998, New England Journal of Medicine. Ibuprofen kills 19,000 people a year taken correctly. So using these medications like ibuprofens or NSAIDs in the short term may be fine. It's the long-term use because you're not getting to the root underlying issue. The nice thing is if you use the herbs and the natural things, long-term is virtually no negative impacts using those. But again, we're still not getting to the root. So use the herbs and the natural stuff long-term, try to get to the root, get to the diet things. That's your best kind of foundational thing. We could also add in some CBD oil, very anti-inflammatory there. Anything else you wanted to highlight supplement-wise?
I would say magnesium would probably be one other one that's low
Great
hanging
muscle
fruit.
relaxer. Yep.
How about also some of the herbal muscle relaxers too? I mean, like valerian and passion flower, there is some
Hmm.
benefit there. Kind of a dual purpose, right? You could use it for sleep,
California
but you could,
poppy.
yeah, poppy would be good too. You could blend all those as kind of a sleep, but also like a pain remedy. And then I
Yep.
like topical magnesium also. I love the Epsom salt, but
Epsom salt bath.
I like it more in a float tank though. I mean, Epsom salt bath, you're like what, a couple pounds at most, whereas a float tank, you're getting 800 pounds. So just not
I
even
still will
comparable.
absorb a ton though. I just do my feet, like just
Yeah.
a scoop or two, and I still feel a huge difference. But I agree. If you can do the float tank, great. But if not, that's still a good in between at home. Try it out for sure.
If I was like super stiff and I'm like, my God, I can't move, I'm going in a float tank because
Yep.
I tell you, I am so flexible in there. Like when I first get in that. So, folks listening, this is basically like a large bathtub with 800 pounds of Epsom salt, give or take, super filtered water. It's warm, it's your body's temperature. You take a shower, it's usually at a spa setting. You get in there, you float on the surface of the water. You have your own little private float tank or float room usually, and you're just floating there and you're there for an hour and your nervous system relaxes. They've used it for trauma and PTSD. So in terms of mental benefits, there's incredible anti-anxiety benefits from it, but for physical too. Also, I tell you, man, when I'm in there, I feel like I'm made of jelly. I mean, I can just
Yep.
move so much better.
Yep.
One of my
Yeah.
favorite
Outside of
things.
Yeah, I would say that, from a nutrient standpoint, amazing. A good myofascial release massage person, a good active release chiropractor, some kind of soft tissue technique. Even if you're doing, foam rolling or get one of the hyper vibes percussor tools at home, just something to improve pliability. Add in some of these nutrients that we mentioned: CBD, curcumin, resveratrol, anti-inflammatories. I think also incredibly underrated collagen. I mean, I do my True Collagen 20 to 40 grams a day. Um, Collagen is a building block for your connective tissue that we don't get a lot of because we're not getting the knuckles and the bones unless you're doing lots of soups with the whole carcass in there. We're not getting these nutrients. And so adding extra collagen is essential for good building blocks for your joints and connective tissue.
I would agree. I mean, a forgotten nutrient that we just don't eat in the
Totally.
modern diet. You can't get that at a steakhouse. I mean, you're getting
Nope,
just the
can't
lean
get it.
muscle.
Unless you're
So,
getting bone marrow, unless they cut the long bone and they have all the marrow for you and you eat that. That's the only way you get it.
yeah,
Or a good
yeah.
soup. but most people aren't getting it. So we're getting more muscle meat. So that's a good step out of the gates. I mean, I had my little coffee here. I had 30 grams of collagen this morning. People aren't getting
Sweet.
it.
Sweet. So regarding
Lots of
labs,
anecdotes of patients. A lot of anecdotes of patients of getting just getting more collagen and changing their diet. Huge chronic joint pain just shifting.
oh yeah, and yeah, the diet's huge. Yeah, so I mean, labs. I mean, we're going to look at stool. We could look at urine. We could look at blood too. But but this is part of a workup we do. So if you do need help, please reach out. I'm sure we could get to something that hasn't been found. I mean, even the Prevotella infection we look for in the stool, like 75% of cases of rheumatoid arthritis are linked to, in certain studies, this Prevotella infection, which is a bacteria we test for. So you've got to look for the microbiome type issues. You've got to look for the deeper stealth infection issues, intracellular parasite type issues. There's a lot of stuff to it, but we just have an approach to it. We kind of peel back the layers here and we get to the root of it. So if you need help, you can reach out. We both work worldwide with people via video and phone calls. So you can reach out to Dr. J. It's Justin at justinhealth.com. justinhealth.com, or me, Evan Brand, at evanbrand.com. And like I said, we work online. So we're very blessed to be able to help people in every nook and cranny of the globe. And it's just a wonderful thing to be able to help people find things that they never found in 20 years of suffering. And we just love to provide that, I don't know, the pot of gold at the end of the rainbow, I suppose.
100%. And you just mentioned some bacteria issues and different joint issues. We know ankylosing spondylitis, which is an autoimmune issue that affects the lower back. Klebsiella is a common bacterial imbalance we'll see affecting the lower back and causing AS. So that's another issue we kind of add to the list. So very powerful. So again, evanbrand.com, justinhealth.com for me. We'll put a list of recommended products and different herbs that we use in our practice clinically. If you want to support the podcast and support us, feel free to click down below, look under references, and you can get all these things that we recommend for our patients and ourselves right down there. Anything else, put your comments below. We really appreciate you interacting, sharing with family and friends. Most people that we interact with, we don't even get a chance to see, and they get benefit. So we love to hear your stories and your success. Evan, anything else, man?
Yeah, if you're on Apple, either on Justin's podcast or mine, since we will publish these episodes on each other's, make sure you give us a review. We would really love it on the Apple podcast. It helps to keep us up in the top of the charts of health and fitness, so we can provide real root cause functional medicine strategies. There's millions of people out there suffering, and maybe a fraction are going to get to hear this. So please, sharing's caring. Leave us a review. Tell us what you think the show deserves, and we'll love you forever.
Thanks, guys. Have an awesome one. Take care. Bye.
Take care.